Colorectal cancer is a commonly diagnosed cancer in both men and women in the United States.
And on this week's Health Talk, a gastroenterology expert will discuss why some people are at greater risk for colon cancer.
We'll also learn what you can do with healthy diet and exercise choices to potentially decrease your own risk.
So stay tuned, we're up next.
Hello, I'm Dr. Andrea Peterson.
And I'm Dr. Eric Mazur. Today we'll discuss the prevention of colon cancer with Dr. Adam Gorlick. Dr. Gorlick is a gastroenterologist with the Western Connecticut Medical Group.
Welcome to Health Talk.
Thank you for having me.
Colon cancer is such an important topic. A prevalent cancer and really causes a lot of morbidity and deaths in the United States.
That's true. It's the second leading cause of cancer death in the United States, so it's a very important topic.
And there are large ways to screen for it, prevent it, and things we could actually do to help prevent it.
That's right. There's the most important thing is to make sure that you get screened, and there's different ways to do that. That you have a discussion with your physician about that. Colonoscopy, sigmoidoscopy. There are stool tests for that as well. But the most important thing is to make sure you get screened for it.
And Adam, we know that certain people are at higher risk than others. Maybe you could go through some of the higher risk groups so they're aware of it at home.
Yep. The family history is one of the more important things. So if you have a family history of colon polyps or colon cancer, you are at increased risk. And the younger the age of that relative to you, and the higher number of relatives that you have, the more important the risk, the larger the risk.
So if you have a first-degree relative, a mother, father, brother, sister, child, with colon cancer or polyps,
That's
even,
right.
say, at the age of 45, you should start getting screened at
10 years younger than the youngest, or 40, whichever is younger. So if they're at 45, 35 would be the age to have that done.
And we also know that colon cancer is one of those diseases which is in part related to lifestyle.
That's right.
So tell us a little bit about that.
So there are some associations that have been found through studies. One of the more important ones, the ones that come up that we get asked about a lot, is red meat. It's been associated with higher intake of red meat, processed meats, as well as a low fiber diet. That's another association with it. Also along the diet is a high fat diet has also been associated with colon cancer.
Way back when I was in medical school, Dennis Burkitt of Burkitt's lymphoma fame came and lectured to us. And he had a lot of experience in Africa, where apparently it's a big high fiber diet among the natives who were eating a lot of fruits and vegetables. And he compared that to the British diet and showed us pictures of the toilet bowl. But that's the first time I ever heard about the relationship between fiber and colon cancer, and it's been borne out to this day.
It's true. It's mixed. We believe that fiber does reduce your risk, increasing your fiber, and we think it's the unprocessed bran that will have the best or greatest benefit to you. The jury's still out. The studies are mixed, but we still push fiber. We think it's a good thing to do. We think it is
so whole wheat
healthy.
bread, not necessarily taking Metamucil every night.
Right. There's different kinds of fiber. The psyllium is soluble Metamucil, and then the unprocessed bran is not soluble. So there are different kind of fibers, and we think it's the unsoluble kind that has the benefit for the colon cancer reduction.
And do we know why there's a benefit?
We don't yet. We don't yet. We think it may have something to do with the microbiome. It's been out there. There are some studies on that maybe that fiber has something to do with the bacteria that are actually growing in your intestine, and that might have something to do with who gets polyps and who gets cancer. But we really don't know.
But we're not at a point yet where we're recommending probiotics, in other words, certain bacteria as a preventative measure for colon cancer?
Not for colon cancer at this point. The studies are being done every year. They're at our national meetings. There's more and more studies on those topics, but there are no recommendations along those lines yet.
Now, I know that there really has been some fascinating stuff talking about aspirin and other non-steroidal inflammatory drugs and polyps and cancer. Maybe you could say a few words about that.
Yeah, there are some medications. Aspirin and the non-steroidal anti-inflammatory medications, as you mentioned, the Motrin, Advil, ibuprofen, those are associated with reducing your risk of polyps. So in some of the cancer syndromes, the FAP, familial adenomatous polyposis, patients get thousands of polyps. And in those patients, those drugs were studied and actually reduces the number and size size of their polyps. So those sorts of medications, we believe, reduce colon cancer and reduce the number and size of your polyps. And then hormone replacement in women has also been shown to reduce the risk of colon cancer as well, as far as some of the drugs go.
Of course, all of those medications can have other benefits or side effects.
True.
So all of those should be discussed with your own primary care, to your
Absolutely.
own doctor
Exactly.
before you engage in a
I
regimen.
knew you were going to say that.
Very important point.
Because aspirin and the other NSAIDs may be associated with bleeding.
Bleeding and kidney
And
problems.
kidney, absolutely,
Very
and stomach
true.
problems. And as you said, the hormonal therapy, we know hormonal replacement therapy is associated with cardiovascular disease in
Yep.
postmenopausal women.
So everything has potential risks and benefits.
There's
and
no free ride.
Talk with your own doctor
Sure.
about your own situation.
That's
But
very
if
true.
you're a patient with cardiac disease and your cardiac doctor puts you on an aspirin,
We like that,
then
for the most part.
you make your gastroenterologist happy.
As far as colon cancer prevention and polyp reduction, it's a good thing.
And what's the connection there? Is it inflammation, do we think?
Not so much inflammation, but it's that process of the small polyp turning into a colon cancer. That there's a sequence where a polyp will grow over maybe 10 years and turn into a cancer, where those medications inhibit steps in it is the inflammatory cascade, but it's part of the growth process. So it really prevents the growth of those items.
And how about obesity and exercise? Do they play a role in?
So some of the other aspects and factors that have been identified are increased exercise has been associated with a reduction in colon cancer risk. Likewise, a sedentary lifestyle has been associated with a higher risk for colon cancer. So those are important things. Increasing your exercise, the studies actually, it doesn't matter what type of exercise you do, whether it's occupational or for leisure, whatever you do to increase your exercise, it will lead to a reduction. The studies are mixed, but there does seem to be a trend there for sure.
So move more.
Move more. Move more.
And obesity?
Obesity has also been associated with colon polyps and colon cancer. I could tell you, we see it every day. It does turn out that the more obese patients typically will have more polyps and have a trend towards more colorectal cancer. So we do see that.
So
How
weight
about
management
smoking and
maybe.
alcohol? Do they have any role?
Yeah, they do. That's what I was drawing a blank on for a second. So increased alcohol intake, moderate or heavy alcohol intake has been associated with increased colorectal cancer risk, and smoking for sure has been associated with it. And it's very important if you are identified as having colon polyps or colon cancer, and you actually undergo a resection for a colon cancer, you definitely want to stop smoking. So part of a healthy lifestyle moving forward is minimal alcohol intake, no excessive alcohol, and avoiding smoking for sure.
And if you've had a colon polyp of a certain type, you've flagged yourself at higher risk for colon
That's
cancer
true.
forever.
Forever, and at least until age 75 or 85. What we do is we individualize for the patients at extremes of age. So for this, typical screening recommendations are between age 50 and 75. After age 75, we individualize it. How's the health of that patient? What other comorbidities they might have? We don't want to hurt somebody by having them go through a colonoscopy. And then at age 85, if there's a less than 10-year life expectancy, we typically don't screen any further after that.
Any other general suggestions for preventing colon cancer or reducing your risk?
Well, the most important thing is to get screened, as we've discussed. Making sure you have that discussion with your physician at the appropriate age, which is 50 in the United States, to recommend screening, unless you have one of those increased risk situations, one of the syndromes, a family history of polyps, a family history of cancer, inflammatory bowel disease, ulcerative colitis, Crohn's disease, they increase your risk. If you've had abdominal radiation in the past, when you were a child, if you had abdominal radiation for one reason or another, you start screening for colon cancer early, 10 years after that radiation exposure. And then an important thing, there is an aspect of race. African Americans are the highest risk category in the United States, so we actually screen African Americans at age 45 and not 50. And it's very important to have that discussion at the appropriate time with your physician.
Absolutely. If you've had other cancers, does that increase your risk? Would that adjust your screening recommendations?
There's no formal screening recommendations, but if you do have other cancers, such as uterine or ovarian, your physician may wonder if you had a hereditary cancer syndrome. So they would be asking these questions about other cancers in the family and what other members may have had to try to work that out if you might be at increased risk.
A lot of people are having their DNA tested with these commercial firms.
Yeah.
Do any of them look for the cancer syndromes that you're aware of?
There are non-commercially available ones where they're doing studies at universities where they have means to check the stool for particular DNA abnormalities for a syndrome. The commercially available Cologuard that's out there now tests a screen of multiple genetic abnormalities in its test.
I was thinking of some of the more general ones like 23andMe or the Ancestry.com. I don't think they do, and I wouldn't want people to think because they have had those and they didn't get some sort of positive result that they're in any way protected.
Yeah, that's not the same sort of screening test.
Exactly.
Right.
That's the point I was trying to make, maybe clumsily, but I didn't think that they were. I don't think you can get these types of screening outside of a medically supervised situation.
We have a little under 2 minutes left. Maybe a few words about colonoscopy versus some of the other potential screening modalities?
Sure. There's lots of options that a patient should discuss with their physician on the best screening test for that individual. Colonoscopy, that's the gold standard to which all the rest are compared to. It's a full evaluation of your colon. It does require a colonic purge. You have to have a drink. You're going to have diarrhea. Your colon gets cleaned out so we could see inside and identify those polyps and remove them. Flexible sigmoidoscopy is a shorter version. It basically looks at a third or a half of the colon.
Are people doing that anymore? The flexible?
Not so much.
Because aren't colon cancers moving
So
in the other direction? At least
the right-sided colon cancers are the ones you hear about. Those are the ones that were missed in sigmoidoscopy, and it's fallen out of favor. We do it a lot in younger patients to identify the source for rectal bleeding. We'll do a sigmoidoscopy because depending on the symptom, you'll see the source for the bleeding within the length of that scope that you're using. The other mechanisms you can screen for colon cancer, virtual colonoscopy you hear about, that's basically a fancy CAT scan that does slices through the body, and the computer generates a three-dimensional image of your colon, and the radiologist can do that, fly through the colon and look for growths on the wall that could identify you as having a polyp, and then you would have your colonoscopy subsequently to remove or evaluate what that abnormality was that he saw. The other tests are the stool tests.
I think a lot of people don't know. You need to clean out with the virtual colonoscopy as well.
Yeah, you're going to get a clean out.
And if you have a positive, you're going to need a second clean out for your next colonoscopy.
Potentially, unless they have it set up where they could do it the same day, and very few places offer that. And then there's the stool tests, which are the detection tests. The stool can be detected for blood and DNA, as we discussed with Cologuard. And those are the other options that are available for the most part.
So definitely talk with your doctor, get screened one way or the other.
But there are pluses and minuses to all of them, although I think we've taken a position on the set that colonoscopy is the gold standard.
That's how I feel.
Thank you so much for this wonderful
My pleasure. Thank you for having me.
Appreciate it.
So we're all out of time for now. We want to thank our guest, Dr. Adam Gorlick, for joining us on Health Talk today, providing such very important information. Thank you.
Absolutely. Please do send us your questions and comments to healthtalk@wchn.org. We'd love to hear from you.
Thanks for watching.
Be well.